I'll give everyone a moment to get settled. Great, let's get started. Welcome to this webinar hosted by Santis Health. Today we'll be unpacking the 2024 BC election and talking about what's next for healthcare here in the province. Before we get started, let me first respectfully acknowledge Santis Health's British Columbia office is located on the traditional, ancestral, and unceded territory of the Coast Salish peoples, which include the territories of the Musqueam, Squamish, Tsleil-Waututh nations. Today, I'm joined by some very knowledgeable colleagues and guests. My name is Steve Vanderwall, and I lead Santis Health Western Practice. I worked as a public policy consultant for more than 15 years, and prior to that, worked in government for close to a decade as a policy advisor in Ottawa and Victoria. I had the privilege of being a senior political advisor to 3 BC Ministers of Health. Also joining us is my colleague Vesna. She's from British Columbia, but is now based in Calgary and leads our work in Alberta. Vesna was in BC this fall as a senior member of the BC Conservatives campaign team, and she also worked prior to that a number of roles in government, including the office of Alberta Premier Daniel Smith. Next is Terry Lake, who is CEO of the BC Care Providers Association. Terry was elected as a BC Liberal MLA in 2009 and served as BC Minister of Health from 2013 to 2017. Prior to entering public life, he practiced as a veterinarian. And finally, Rob Fleming. Rob was elected as a BC NDP MLA in 2005. He served as Minister of Education and then Minister of Transportation Infrastructure as well between 2017 and 2024. So some housekeeping. Please submit questions anytime using the Q&A function at the bottom of your screen. We look forward to discussion with our panel based on your questions following a short presentation. These slides and recording will be sent to participants following the event. As well, you'll also be all sent a survey and a webinar, which we hope you'll complete. A little bit about Santis Health. We are a public policy, communications, and advocacy consultancy established 12 years ago. We focus exclusively on health and life sciences and have a team of more than 50 experts located across the country. We expanded to Western Canada 2 years ago, which is when I joined, and we work with a variety of clients in the public, private, nonprofit sectors. We provide government relations, strategy management and consulting, and communication stakeholder engagement advice and supports. Our agenda today, we'll first discuss election results. We'll talk about what happens next, what this means for health, and review some key takeaways. Following that, we'll have a panel discussion and Q&A. But right now, I'll pass it to my colleague, Vesna.
Thanks, Steve. So the reason why we're all here today, talk about the election and the election results. So we'll go to the next slide. Recent election, we found that there's 3 key issues on this campaign that we're focused on, those being healthcare, housing affordability, and public safety. As you can see, very close result, no majority and too close to call as of election night on Saturday. To dig into these numbers, the BC NDP, 46 seats, Conservatives 45, Greens with 2. BC NDP lost 16 incumbents, including 6 ministers that either stepped down or were not successful in being reelected. Looking at the Conservative side, they've elected 45 MLAs. It has been 40 years since they have elected an MLA, that the Conservative Party of BC has elected an MLA, and 100 years since they've formed government. So a big change there. A number of ridings you'll see along the bottom, extremely close results. These ones within a 1% margin. These are over the weekend going to be recounted Saturday and Monday, along with a review of 49,000 ballots yet to be counted. This is including the mail-in ballots, the out-of-district ballots, and manual ballots that still need to be reviewed. Let's head on to the next slide. So I like maps, so we're going to go over this. You can see the difference here. So you'll see the BC Conservatives won most of the seats outside the Metro Vancouver on the mainland. That's on this big provincial map here. If we dig into the zoomed in one on Greater Vancouver, you'll see that there is a divide between the north and the south of the Fraser River. NDP kept most of the seats, or 11 of 12 seats in Vancouver, all of Burnaby and all of the Tri-Cities. Whereas here along the bottom, you'll see the Conservatives are on track to win 7 seats in Surrey, 3 out of 4 in Richmond, and all the seats in the Fraser Valley. We'll dig into this a little bit more after, but as I mentioned, healthcare being a primary issue, campaign focus for everybody on this campaign. You can see the flip with along the bottom in Surrey. I mean, the Conservatives promised a new children's hospital maternity ward in Surrey, as well as some more investments into Mission in the Fraser Valley. So that could reflect some of those results there. In short, the urban and some suburban voters voted to support the current government's agenda, while others indicated they wanted change. And of course, you'll see some green there. So a number of British Columbians said they supported the BC Greens as a voice in the BC legislature, with electing two BC Green MLAs. Next slide. So initial reflection, it's tight outcome. Healthcare played a role moving votes in suburban Vancouver. We'll also see that there are only these tight seats with, I mean, Wanda Fuka, Malahat, there's a difference as of right now of only 20 votes. So over the weekend, we could see some changes. The Greens will once again, like 2017, will likely provide a balance of power. And then last but not least, the speaker. So there will be a need for a speaker and need for the party with the most seats to provide a speaker, which could result in further instability in the legislature, which we can also dig into during the Q&A portion. Back to you, Steve.
Perfect. So what comes next? First, as Dustin mentioned, the Elections BC needs to finalize election results. The final count is this weekend, October 26th to 28th. And if the result remains close, there will be automatic judicial recounts and as well potential legal wrangling. But after all this, it's expected one party will have the most seats. Then the negotiations. The BC NDP, BC Conservatives are already appealing to BC Greens for their support. It's unknown if there'll be a formal agreement like there was in 2017. But let's remember that David Eby remains premier until he advises the lieutenant governor he does not anticipate being able to command the confidence of the legislature or loses the confidence vote. So the cabinet. Whoever intends to form government will be able to appoint an executive council. And at that point, they'll have to get ready for session with briefings, decision-making, get ready for a throne speech, recall the legislature. It's unknown when this could take place. There's a chance of a short session this fall, but more likely the legislature reconvene in the spring for a throne and budget. And at some point, there would be a formal confidence vote, which would then test the outcome of the election. So what does this mean for healthcare? So as Vesta mentioned, there were three key issues during the election campaign over the healthcare. Number one, access to emergency care, long wait times to access specialists. Number two, the need to train, recruit, and retain healthcare professionals, including doctors, nurses, other health professions. Number three, debate about how to best manage mental health addictions crisis, which also spills over to concerns about street disorder and public safety. So for these next slides, we're going to outline the vision and commitments each party proposed and conclude with where there's overlap in their platforms. For the BC NDP, they released a 66-page platform on October 3rd with a number of commitments related to healthcare. Many of these were a continuation of the plans that they've been executing since taking office. And of note, they promised that everyone registered in Health Connect registry will get access to family doctor by the end of 2026 next year. They will train, hire more doctors and nurses, and immediately license physicians trained in Canada and require physicians trained in approved jurisdictions to be licensed within 6 weeks. Expand the role of several healthcare professionals, such as physician assistants, pharmacists, and midwives. Expand access to primary acute care, including a maternity strategy, new resources for cancer diagnosis and treatments. Expand the travel assistance program for British Columbians who need to travel to receive specialty care. And finally, continue to increase mental health and addictions treatment beds, including 400 new beds promised by the Premier in prisons and hospitals to provide involuntary care for those with severe mental health addictions issues. Pastor, my colleague Beston has summarized the BC Conservative health commitments.
Thank you, Steve. So yeah, the Conservatives released their full platform a bit later than the NDP near the end of the campaign, but the health commitments were mostly laid out late August in their Patient First healthcare document. While there are a number of commitments which commitments which overlap with the BC NDP, which Steve, you'll outline in a moment. Here are some of the notable ways a John Rustad-led government would change the way healthcare is currently managed, funded, and delivered in BC. The first one I want to mention, which was a major point of contention, I think, during the election between the NDP and the Conservatives, was the use of non-government clinics to deliver care, similar to other provinces, which we've been seeing in Alberta and Ontario. This would be a significant shift from the status quo and the BC NDP's firm position to minimize the role of the private sector in healthcare. A couple other ones is there would also be a move away from block funding for health authorities and hospitals to activity-based funding, saying that this is incentivizing better and faster care for British Columbians and trying to get through the backlog. Also a promise to set wait times for select diagnostics and surgical procedures, and also saying they'll offer to pay to send patients out of province if those deadlines can't be met. The one that was super interesting that I found was the 5-point plan on for women's health, which included expanded access to fertility treatments. I think it included 2 rounds of IVF, as well as expanded midwife training. There was also 1 month maternity leave for women who had miscarriages. And then seeing that the mental health and addictions was also a huge focus this campaign, focusing on the recovery model that has been viewed and implemented in Alberta now, and also a promise to ban all illicit drug use in BC emergency rooms and hospitals, which has also been a hot button issue through the spring and summer. Finally, the BC Conservatives would repeal the Health Professions and Occupations Act, which is the BC NDP's legislation, which merged BC health regulatory colleges from 15 to 6, and reduces the autonomy of professions to self-regulate. Back to you, Steve.
Thanks, Vesna. So the BC Greens were the first party to release their full platform October 1st. These reflect their priorities and values, and I'm sure both the BC NDP and BC Conservatives are examining it very carefully to see where they could offer to take action and share priorities. Their main commitment was to establish 93 new community health centers, 1 in every riding, within 1 year. They said their plan was based on a model proposed by former federal health minister Jane Philpott, which would see doctors, nurse practitioners, nurses, physician assistants, mental health professionals, and specialists all located in one place to reduce referrals and long wait times. This differs from the BC NDP's UPCC model, which only includes primary care. Their other touchstone is to reject any involvement of the private sector in healthcare, saying the BC NDP still provides millions of dollars each year to private providers. I should also note that the BC Greens do not support involuntary care for those with serious mental health and addictions issues, putting them out of step with both the BC NDP and the BC Conservatives. So we've talked about each party's priorities, and I acknowledge there were many others that were also important we didn't capture today. But now let's look at where they agree, which gives us an idea of priorities in health, no matter which party forms government. So first, they all commit to some form of review of the health system to reduce overlap and redirect dollars to patient care. I'll be very interested to see where this review looks like, especially given the election outcome, which showed voters are not happy with the status quo. I was in the BC Minister of Health's office when the last health reorganization took place, and I can confirm this is a complicated, difficult process that takes time to settle and show results. We can also look to Alberta, which is undergoing their own health system reorganization, to get a sense of the challenges and timelines we may face, which is something to keep in mind given the likelihood of minority legislature. They also all agreed to increase health spending. I'll talk more about that in a moment. They all agreed to address gaps in access to family doctors and primary care and to train and hire more health professionals. They committed to reduce the administrative burden on the doctors. There was agreement to continue to invest in new hospitals and services for cancer, and also to add new long-term care beds. I'm sure Terry has some thoughts on that. So for our last slide, before I bring our panel in, let me walk through some key takeaways. Firstly, the Minister of Health will be under incredible pressure to show progress on their party's commitments, but who forms government will drive the definition of that success. If it's BC NDP, look to them to build on the current system and strategies, while the BC Conservatives are proposing to make significant changes to how the system is funded and operates. I spoke a moment ago about commitments to significant budget increases for health, but whoever forms government may face headwinds in the years ahead given the size of the deficits. Longtime Health Deputy Minister Stephen Brown is set to retire, and there will be potentially a new Minister of Health. These are also likely to impact decision-making going forward. There are potential federal implications. A re-elected BC NDP government will continue to offer the Trudeau Liberals an ally and national pharmacare partner, whereas a BC Conservative government would be a significant shift in that relationship. And finally, as I mentioned, there's going to be some sort of health system review. This will take up bandwidth and energy and potentially cause tension between the ministry and health authorities. So now I'd like to bring in our panel for discussion and welcome participants again to continue to post questions using the chat function. So my first question for our esteemed panel: what impact do you think health had in the election outcome? Maybe start with you, Terry.
Thanks, Steve, and thanks for Santis for putting on this webinar today. I think health, has always been one of the top 3 issues in almost every election I can remember, but it's never been the ballot question. It's always pocketbook issues that tend to be the ballot question. But as we see the health system under pressure, mostly from, issues of demographics, the aging population, including the aging population of our health professionals, it becomes higher and higher in issues related to elections. And at some point, it will become the ballot question because we've seen a deterioration in healthcare, not just here in BC, but around North America and Western countries for the reasons I outlined. So in this particular election, I think it was definitely an issue. We were challenged with getting everyone a doctor back in 2015, and it proved remarkably difficult to do because guess what? It takes about 10 to 12 years to produce a doctor. And, nurse practitioners certainly are a great complement to primary care practitioners and take a little less time, but it does take time to turn that around. And, for all the other reasons that I mentioned in terms of retirements, it's difficult. So this government has, like others, failed to produce a doctor for everyone who needs one. And that causes all kinds of issues for people. There's 1 million of us in British Columbia without a family physician or a nurse practitioner. And when we see the emergency room closures throughout the province, but particularly in smaller communities where the Conservatives are very strong, that is a very big issue. And this is despite almost a doubling of the healthcare budget from $18 billion in 2017 to $34 billion currently. So I think it was a big, big issue for many, many people around the province.
Any other thoughts, Rob?
I agree with Terry, and thank you as well, Steve, to your colleagues and to Santis for arranging this. I think it's interesting. It's early days going through the election, but if we go by the opinion polls, both pre-election, during the election, and certainly lots of the media coverage, healthcare was in fact the dominant issue in this general election. I think it should have been an advantage to the BC NDP. Certainly the polling shows that most British Columbians believe the NDP is the better party to handle healthcare. But it became a more potent issue for the Conservatives to kind of vent patient frustration with parts of the system that are not performing well, at least in their own personal lives. And it's hard to argue with that. So I think one of the things that didn't help the NDP perhaps in the way they thought is the scale of the investment, as Terry mentioned, has been huge since 2017. Some of the outcomes that are starting to improve, or to use Premier Eby's phrase that he used for a lot of issues, turning the corner. There was a lot of evidence of that. If you're one of the 250,000 people in the year 2024 who went from the healthcare registry to having a GP, that was a big sigh of relief in your life. That's not an insignificant number of people, but it leaves, perhaps 500,000 British Columbians who are still waiting on the registry. So they're not there yet. And that'll be interesting should the NDP be able to form government after we get through all these steps that are yet to confirm where the votes finally landed, how they want to play things. committing to having everyone have a doctor by the end of 2025, by which I think they mean New Year's Eve, 2025, December 31st. Sure, there's some pace out there. About 20,000 British Columbians are getting a doctor every month. That means the pace has to increase even more. That'll be a difficult one to fulfill. I think there were some other issues, though, and perhaps this is where the BC Conservatives turned healthcare against the NDP. And it's really where it spills over into antisocial behavior and street disruption. It's the opioid crisis, which gave quite a bit of social license. Terry was there when he declared as a state emergency in BC. It really hasn't gotten too much better, the number of opioid deaths. The experiment with Health Canada around safe supply is seen as contributing to homelessness and street disorder. The Premier certainly tried, I think, in May to clamp down on some of the things that were really upsetting to people around open drug consumption, with the BC Association of Police Chiefs standing behind him. But it was still an issue there for a lot of people. That was one that did not play in favor of the NDP. Was really a kind of a catch-up issue to try and nullify it, and it was quite significantly used by the BC Conservatives to their advantage.
Thanks, Rob. So, a personal question as well. All parties talked about using technology in health to improve care and reduce administrative burdens. Why does something that seems so simple take so long?
Well, I've got some scars to prove that it is very difficult, Steve. But let's just understand why it is so important that we overcome the obstacles. When you look at productivity, and Canada has a problem with productivity. If you look at productivity in other sectors of the economy, there are sectors that can really utilize technology to increase productivity. That is more difficult to do in healthcare because you can't replace humans. And, about 70% of the cost of the healthcare system is for human resources. And we know that that's been a huge challenge to meet the demand for people in healthcare. So without taking one job away from anybody, and that's always the fear with technology and things like artificial intelligence, without taking one job away from anybody, we need to optimize the people we have working in the healthcare system today. And so we have to figure out a way to barge through this colossal inertia that is there in healthcare with technology. Everyone's saying, well, we're going to axe the facts. But, as someone pointed out, Colin Hanson, I think, tried to do that 20 years ago. I said the same thing when I was minister. And we're very reluctant to employ technology, except, when we had COVID, all of a sudden, the only way we were seeing our physicians was through a screen. And it worked absolutely, for the most part, very, very well. There's no question that there's some appointments where you need hands-on, but you can do so much through technology. And I would challenge, and I'll probably get in trouble from my radiologist friends, why we need radiologists to be reading x-rays and CT scans, ultrasound, et cetera, when artificial intelligence, based on the hundreds of millions of scans that have been put into the algorithm, can read those very well. It doesn't mean we don't need radiologists. We will need some, but there's so many stakeholders in healthcare that don't want to give up turf that it makes it very difficult to change tack and embrace technologies. We should be talking to a chatbot and getting all of the information into that chatbot before we see our physician. So when we do see our physician, they actually have, differential diagnosis. They've got the family history. They got the tests that have already been done. And in fact, the chatbot could order some screening tests before you see your physician. And that way you're more productive when you finally do see your physician. Lots of ways that technology could optimize the person power that we have in healthcare at the moment, because we just don't have enough people to do all those jobs.
Yeah, one thing I'd add to that is, especially with the HHR issue, and the Conservatives were mentioning too, it's a staffing issue with these backlogs, ER closures. I think there was a part in their patient first announcement of increasing or using telehealth resources, and it's interesting to know now there's the chat boxes like Terry mentioned, but there's with AI, with cameras, with all these different types of utilities and tools that are used that are available now, it can really make a change for a variety of these the mental health issues, the ER closures, and as well as like the radiologists, and it can be utilized all across the whole healthcare spectrum.
So thinking of technology, also the private sector, and there are very different views, the role of private sector in between the parties and the role they could play. Did the election tell us what the public's opinion was on this important issue?
I don't think it did. I don't think it got too far into that. I think it was really around frustration around whether your family has a doctor or not, which is, high level anxiety if you're a senior or new parents with an infant or young kids. But I think of the technology. I mean, the low tech sort of things that were talked about that got some praise is a lot of people go to their pharmacist now for the increased scope of practice for pharmacists. I think nobody would disagree with. I certainly haven't heard that. In fact, it could go farther, and I expect the government will try and deepen that. The use of LPNs to do basic medical services and part of a more important part of the primary care team, that will certainly continue. Premier Eby brought up physician assistants as the way forward on reducing the amount of paperwork that specialists and GPs have to perform as part of their daily workflow, and put that to the side for somebody who can manage that and allow more personal care. But I think there have been some bad experiences around large data systems, custom built data systems, I should say, in health authorities that ended up costing hundreds of millions of dollars and didn't perform to the outcomes that were promised. There was some turn towards more off the shelf things in more recent years, but AI in healthcare is something where BC is going to have to make a decision. Do we want to sit back and wait and see how it works in other jurisdictions, or do we want to get there first and see what it can deliver? I think it makes a lot of sense to have that as part of the basic functioning of a hospital, for example. I've seen it work, and I'll just put my transportation hat on for a second. At the YVR International Airport is actually one of the most significantly cited international airports in the world, where they have a digital twin that offers real-time insights across thousands of data points. Hundreds, if not thousands, of employees are inputting what they're seeing into the system, minute by minute. But it also has scenario projecting capacity, so it can look out ahead in terms of what needs to be done. It can project flu season, say in December, and if the system got crashed, or BC Day weekend when lots of sports injuries happen, those sorts of things. It can tell you where you need to optimize your triaging of patients coming in, so that you don't have the ER closures that Vesna talked about. So you can surge employees into an area, and it's just giving you the insights, the power of the algorithm that Terry mentioned into the system. So that'll be an interesting issue to see whether healthcare leaders, perhaps, I know we're going to get to this question later about who's leading the ministry, but perhaps we'll have a deputy minister who is new and interested in that area.
But I want to just maybe disagree with Rob a little bit on his opening statement that the privatization or the private use of providers in healthcare, wasn't really an issue. I think people don't really care who provides healthcare as long as they get healthcare. And if it's provided by someone in the for-profit sector, paid for by the public system, as we have always done in Canada, to a greater or lesser extent, as Vesna mentioned at the outset. But, in long-term care, for instance, 1/3 of our long-term care is provided by for-profit providers, and generally speaking, have done a tremendous job doing so. And it's publicly supported. People that live in those care homes, they're treated, no differently than in other care homes. In fact, many are treated extremely extremely well. And so I think the public is getting more blind to the provider and the sort of owner of the service. They just want the darn service. And even if you could take that even further, surveys show that people are recognizing that there should be actually a private option or an insurance option available, as there is in every other publicly funded healthcare system in the Western, developed countries. We're the only one that doesn't allow for that provision. So I think we are seeing a sea change based on the number of baby boomers that need more healthcare and will need more and more healthcare. And you know what? They just want it, and it's going to happen.
I don't disagree with that as it relates to long-term care and assisted living. I think there is a comfort where housing and healthcare needs are aligned, that it's means tested. For example, we do have to have a nonprofit system that is lagging behind as we hit the demographic wave that you're talking about, Terry. I mean, I think when you were minister in 2012, about 15% of the population was over 65. Today, it's north of 20%. So we are, that silver tsunami. I don't know if Gordon Campbell coined that term, but he used it in one of his throne speeches, is a real factor now. But where people have a high level of discomfort, and where they're proud of, Medicare and its basic principles that are enshrined in the Canada Healthcare Act, is buying your way to the front of the line on diagnostics, on procedures, on surgeries, those sorts of things. And I think Mr. Rustad made a slight mistake by saying in a private tape conversation that, we got to go and undo the Canada Health Act in order to enable that sort of privatization of healthcare. I don't know if he meant to say it in that explicit terms, but it was a comment made in a private audience that came to light, and it wasn't used enough to obviously create a wedge issue, or the seat count and the results of the election might have turned out differently. But that's the crux of where Canadians and British Columbians are uncomfortable with private healthcare. If you start to, cannibalize the public healthcare system and make it profit-based on a clinic system where some people can buy their way to better care, that's the beginning of Americanization, and I think that is a weak point for the BC Conservatives or any other party that's going to go in that direction.
We could have a long discussion about this, Rob.
Sure.
Yeah, the higher performing healthcare systems in France and Spain and New Zealand and Australia and the Nordic countries all have a private part of the system. So anyway, that's for another day, Steve. I look forward to that panel.
Sure. Well, if you look at why the Conservatives aren't running the UK anymore, it's because they ran down the NHS, and that was the ballot question, certainly in that recent election.
I do want to point out, though, Terry, what you mentioned about the European healthcare, and that's what John did mention. I think it was last week of the campaign. There was the NDP came out with American style healthcare, and it is definitely Mr. Rustad on the platform. I think the idea was to follow the European platform, a European model of where they were going. If that was communicated and landed, I think that's a different conversation to have. But I think that's looking at the platform, reviewing that was more the model that they're going after replicating.
Well, clearly, if the election results go the other way and there's a change in government, that would be something we'd see a big shift on. Looking at the Q&A here, I see someone submitted the question, can you speak to seniors care in BC? It was a large platform commitment from the Conservatives, less so from the NDP. Any thoughts? I don't know, Terry, this is a bit your space. Any thoughts on how the party spoke to seniors care, what the commitments were?
Yeah, and just, as I am working in this space, obviously my views are shaped by this, but the demographics are undeniable. And, I don't think any government across Canada has come to grips with the tremendous amount of healthcare needs that will come with an aging population. Rob mentioned, we're north of 20. We're actually almost 25% over 65 in the province of British Columbia. And, anyone that's studied healthcare policy knows that, a lot of the healthcare that you use, 80% of it comes in the last part of your life. So the demand on the system is going to be huge. And the way we manage seniors' healthcare is going to determine the effectiveness of the whole healthcare system. when I was minister, there were about 10% of patients that were considered alternative level of care patients sitting in hospitals. These are patients that are looking for to be discharged either at home with more home supports or into long-term care or assisted living. Today, that number is more like 20%, and at certain times of the year, it can go even higher. That's because we simply don't have enough assisted living, long-term care, or home care. And unless we sort that out, we're not going to be able to have a hospital system that works effectively. Now, every party committed to building more long-term care spaces. And, you know, I've got to give credit to this NDP government, invested a tremendous amount into seniors care through the pandemic and beyond. But if you look at their announcements for replacement and new long-term care spaces, these are mostly through owned and operated health authority sites, and the cost is anywhere from $1 to $1.8 million per long-term care space, which is absolutely unsustainable. In Alberta, a recent project came in at $535,000 per long-term care bed. So I think we have to look to the private sector, both for-profit and not-for-profit, to build these new long-term care spaces if we want to make our money, go further than it would if we built through owned and operated. There's no question that it is far more expensive when government takes on a capital project than when you partner with the private sector to do the same. And that's why hospitals have been P3s for a long time, many, many major construction projects. So I think we definitely, we say we need 30,000 new spaces by 2035, and we're on track to maybe have a third of that. So it's only going to get worse unless we address this critical problem.
Yeah, I think a lot of the discussion on seniors care, again, just like everyone having a family doctor and other initiatives that go back at least a couple of decades, shifting towards or keeping people out of assisted living and long-term care and those kinds of programs, better at home, hospitals at home. I think those are the renamed, rebranded programs under the NDP were part of the platform. And obviously it proves easier said than done, but it is the most cost-effective thing to do. For low-income seniors, there was a specific commitment around the SAFER program, which is basically a rent subsidy for low-income seniors who rent their apartments and are getting pinched on the affordability, and allow them to stay there. But there's a huge catch-up on constructing assisted living and long-term care facilities, ones that are affordable in particular, but also allowing private for-profit to be able to, expedite that through. It's a municipal thing too, in terms of zoning and all kinds of permitting and those sorts of things to get that done more quickly. The demand is going to exceed supply. It already does. That problem is going to get worse unless the next government can kind of get over that curve. But look, the NDP has 29 capital projects for new and expanded hospitals. There's 4 of those are regional cancer centers that are under construction but not completed yet. One in Burnaby, one in Kamloops, one in Surrey, one in Nanaimo. That's seniors care, I think, primarily in terms of who uses it. But it wasn't a vote attractor for the NDP because none of them were in operation yet. If this government can hold itself together in a coalition and see those sorts of things get built in service, that's going to help a lot more in a future election than just saying, "Hey, look, we finally broke ground on something," but it's not there yet.
Yeah, I just want to chime in. I think the angle that the Conservatives took with, their big promise was the 5,000 long-term beds by 2030. But the traction they got was that the hospitals are being over capacity. The beds are being used by this. They're better. They can be opened up. I think that communicated to the general public a lot better of the simple message of making more beds in these long-term care facilities or wherever they are will open up and create safer, open up more space in their hospitals. And there's also the messaging about with the opioid crisis and the use of opioids in hospitals, and it's not a safe environment for seniors, which is a bit of more of an aggressive tactic. but it resonated with some people. But it was just an interesting way how they approach that as opposed to NDPs and the Greens.
I think that's a really good point, Vejna. The substance use issue in hospitals, and you've got the Greens promising to open up safe consumption sites in every hospital and allow safe inhalation sites in every shelter. I don't think that the public is in line with that, and I think the NDP, should they have an agreement with the Greens, I don't think they would be very agreeable to that either. So it'd be interesting to see how the Greens healthcare platform, which is, well, we could talk a lot about that, but whether or not the key things in the healthcare platform of the Greens would be accepted by the NDP, I suspect they would not.
So I'll draw a question from the chat again, and the moderator's perspective, and maybe take the first crack at it. And the question is, what would the biggest impact minority government be on healthcare in BC? And I would say I'm fascinated with this, and a lot of that would depend on the stability of that government. And if it is unstable, people expect an election in shorter order, it would probably adjust the lens of a premier and a minister of health looking to show early momentum. But as you know, Terry, I'm sure yourself as well, Rob, health is just a big ocean liner, and it takes a long time to turn and make change. And I would think it would be a challenge for anyone to make the change that they've outlined in platforms within less than the 4 years they've outlined. And I think the public would be impatient. I'd also say that with so many new legislators in the legislature, I'm curious what the learning curve will be. I think certainly on the Democrat side, there is more incumbents that were elected, but the Conservatives, there are some who served previously, lots of new folks. So I'm also curious what the debate in the legislature will be with so many folks new to it. But welcome other thoughts.
Well, I guess the key question is, what happens with health? We know Deputy Minister Brown is set to retire in November, and Steve, has been there, well, my whole term plus Adrian's term, so 11 years, and has done just a stalwart job. But he's, that leadership will be gone. If we had a majority government and the NDP were in government, they would likely, I suspect, appoint a new health minister. For a fresh start. But do you appoint a new health minister now when you're not sure how long that government's going to be in place, and have someone new to a huge file be out there on global, answering tough questions about when someone has a problem at an emerge? I think not. And I think so it means Minister Dix will likely remain in place for now. But so does that mean things will kind of just stay at a steady state? Or will he actually, as you say, rev up the engine so that we can show some results? They can show some results before any election, let's say in the spring. So that's a very interesting question. For instance, there was a series of requests for qualifications for renewed and new long-term care beds in Fraser Health to the private sector, not-for-profits and for-profits. But where are those RFQs in other health authorities? If Minister Dix was continued to be the health minister, he could probably issue a whole bunch of those and then indicate that, yes, we're moving forward with building all these very desperately required new long-term care spaces. So that will be a very interesting question. I don't know if Rob has some insight into the mind of the Premier and keeping the Minister of Health. Be interested to hear from you, Rob.
Yeah. Well, I'm sure he's thinking about it, to be certain. And, it'll be interesting to see what the goals are, whether, of course, the NDP gets a formal agreement, like a confidence and supply agreement with the Greens, what the duration of that is. If, for example, they take it in 2-year chunks to see whether they get through a 4-year mandate, that might lend itself to a new minister or not, for the reasons that you've stated. Obviously, Adrian Dix is tremendously talented, and the Premier would think he can provide some strong front bench support in a variety of roles. But I'm not sure, because right now all is not solid, and the goals of what is to happen are of interest. I know Mr. Rustad has said we'll take the earliest and every opportunity to bring down the government, which is interesting because all political parties presumably are broke right now, having spent everything in this campaign. I can remember coming in 2005 as a fairly large opposition under Carol James, and we were terrible for the first couple of years. And we got better.
Only the first couple, Rob?
We yes, we kept losing elections, but we were better at losing. No, but nobody knew where the washrooms were. They didn't know what their jobs were. They didn't know their way around the place. They didn't know parliamentary rules of order, and they certainly didn't have a great handle on files. And they got more competency and expertise on that. BC Conservatives are going to be the same way, so time could actually be their friend if they prove themselves an effective, competent, capable opposition, or they could not adapt well. And we'll learn more about the personalities and the areas of focus as they take on that role. So time could be the friend of both the opposition or indeed the government if they can. I would say in healthcare, a couple of years is what the NDP would want, because they are making significant progress on some of the most observed files, important areas of healthcare, and then they could, run on that in a couple of years.
I'll just weigh in to say, well, I would not presume to know what David Eby is thinking. My hunch is he's under tremendous pressure to demonstrate change, not the status quo. So while no comment on Minister Dix's track record, my hunch is we'll see someone new there, and to demonstrate that there's new approaches, new ways of thinking. And again, to agree with you, Rob, there's many other important jobs that would benefit from a strong front bench members like Minister Dix. Someone asked about, please discuss initiatives related to support for cancer patients and cancer research. Certainly something that generated a lot of headlines over the last year. Any thoughts, Vesna?
Yeah, I know a part of the women's health announcement, the Conservatives, there was an announcement that John made about fighting cervical cancer and ovarian cancer. So investing in more prevention research. I actually, Rob, you guys brought in the HPV testing kits, I believe, right? Yep. So continuing with that, I know it's an area that's close to his heart, as his wife had cervical cancer, and the prevention with these HPV kits is also something that can help that. That's my part. I don't know, Rob, you want to chime in on your guys's?
I mean, that's a fairly new initiative, and it's quite transformative and beneficial as both a cancer and rural healthcare innovation. There may be opportunities to do more screening programs like that help people who live in the rural part of British Columbia. Hiring more cancer specialists is obviously an ongoing process. Building the new 4 regional cancer centers that I mentioned, a second one in Surrey, for example. But you look at Vancouver Island, close to 800,000 people now. Takes 11 hours to drive from the north end to the south if you're going the speed limit. And it's on the southern tip where you get that kind of care. There were some other things that were patient driven in terms of, I mean, sadly, not only is cancer care the worst thing you'll hear, getting cancer is the worst thing you'll hear from your doctor, it also can be a very tricky thing to negotiate with your employer. So 27 weeks guaranteed leave for cancer patients was another thing that the NDP brought in. I wouldn't see the BC Conservatives, should the results turn this weekend, meddling with that. That's quite popular and common sense. So I think the diagnostic work as well, and explaining that this Bellingham situation, like if you had cancer and you were being sent to Washington State, you might find that a hurt sense of pride as a British Columbian, but you'd be grateful for the care. That's always been meant to be temporary, and I think the government is going to have to show that that is what it is to get at the backlog and to increase BC's capacity. There was an interesting kind of refrain from Mr. Rustad, which was, we got to go out and seek extra capacity in neighboring provinces. Well, there actually isn't any. And of course, that was the first place that the BC government looked and couldn't find it. And that was really the genesis of the Washington State option, and so BC is going to continue to work on made in BC solutions to try and to get cancer care available for all BC residents, and much closer in regional hubs to where they live.
Yeah, I think cancer care is a huge challenge. Oh, and by the way, I want to just note for the audience that Rob's the first transportation minister that actually goes the speed limit. But cancer care with the aging population, of course, will be more important. The question I think was around research, and this is interesting. You know, we're a province of 6 million people. There's cancer research being done in huge centers around the world. So do we want to invest in cancer research or cancer care delivery? And with limited resources, you have to make these decisions. Those are hard decisions to make. But I would argue that, not to say we abandon research in the province of British Columbia, but I think we need to focus on delivery of care. And while these cancer centers are being built, what can we do to make it easier for someone that has to go to Kelowna from Kamloops every day for chemotherapy and radiation therapy? How can we make it easier for them in terms of transportation, in terms of accommodation? I think we've got to have a strategy. I know the program to offset costs for people coming in from rural areas into the cancer centers has been increased, but I think we need to do more to make it easier to get people to where they need treatment while we're distributing the treatment, because that's going to take 3, 4, 5 years to do.
And I'll just close by saying I also watched and was interested in the government's decision to use the Bellingham Clinic, and wondered if that was almost the interesting linkage with what the Conservatives were proposing, which was wait time guarantee. And if the government didn't meet its benchmarks, then they would send you out of province. And it was almost that interesting alignment there. Although I take your point, Rob, that it was not meant to be permanent and meant to build out that capacity, which I'm sure would be the priority of a Conservative government as well. Looking to the chat, question here. Outside of addictions and substance use health, what are the notable areas of mental health considered in the campaigns? And I'd agree with that street disorder and severe addictions kind of sucks up a lot of energy, but there are some broader mental health issues. I read in the platform's commitments to grow that more broadly as well, but just curious about how others saw that debate evolving on the campaign trail.
Well,
I think Terry and Vesna said it before in terms of a potential obstacle to NDP Green cooperation is the difference of opinion on involuntary care for those with brain injuries and dual diagnosis, psychosis and opioid addiction, and how to treat them, and whether that's it'll be interesting whether that requires amendments, new legislation, which would have to be very well crafted to respect the Charter of Rights and Freedoms in the Canada Mental Health Act and other pieces of legislation, but would also need some votes in the House. So again, going back to Mr. Rustad's promise, even where he agrees with the direction of the government, whether he's going to vote it down each and every time, despite that fact, that could be one of the issues that's a flashpoint or a sticking point. Again, we've got 2 new Green MLAs though, so they might have a difference of opinion with Ms. Firstenow, and her position, I believe, was mostly based on Indigenous leaders sort of seeing that as a harkening back to removal of in this case, I think they were worried about adolescent Indigenous teenagers from communities. If they became a supportive stakeholder, I wonder if that might shift it and resolve that difference.
Yeah. Just to build on what Rob was saying, the Indigenous part is really interesting. I think the Conservatives mentioned something along the lines of that, with the not talking about mental health and addictions, but talking about the whole foster care system of including more Indigenous voice into that. But what was in the platform, the Conservatives, which I found interesting, was repurposing, redeveloping the Coquitlam Riverview site, which I learned a lot about being on the campaign trail. I'll admit I didn't know much about the history of that and how many people that supported, and I think that also gained a lot of interest and support, mentioning that, as well as more of the mental health supports within schools seeing that I think it's a post-COVID thing and the adolescence and the opioids starting earlier and the drug addiction problems kind of all ties into each other. So trying to start with the mental health supports earlier to help avoid that, a lot of those issues.
Looking at the questions here, there's one asked about, can someone comment on prescription drug spending? BC spends less per capita and covers fewer drugs than most places in Canada. Why, and can improvements here be part of the larger plan for improvement? And I know that maybe references a report by some patient groups at GI Society looking at those gaps now that there's alignment in Canada with the Canada Drug Agency, the pricing, Pan-Canadian Pricing Alliance, that BC is a bit out of step, but I'm not sure. Any thoughts? Maybe just Terry might have some background in that about that a campaign issue and any action going forward, do you think?
Well, I think there's a couple of things here. First of all, the Pan-Canadian Pharmaceutical Alliance was created, back in about 2015, 16, and has done a lot to bring down the costs of many, many drugs that are listed across Canada. And when you talk to any American, of which I did just recently, who got their drugs from Canada to save money. So we're certainly paying less than our American friends, but more so than New Zealand, for instance. So we've learned a lot and we've made a lot of improvements there. BC does tend to be more circumspect than other provinces when they're looking at drugs to list. There were times, for instance, when you would get a lot of political pressure from patient groups to cover a particular drug, and some provinces were under a lot of pressure, and then they decided to start covering that drug, which meant the pressure that then flipped to the other provinces. And are you going to cover that drug? And so you have to look at the cost benefit analysis, and that's very hard to do because we're talking about individuals who would potentially benefit from the coverage of a drug, and yet as someone that is responsible for taxpayer dollars, you have to look at the cost benefit, and that's a horrible, horrible decision to make, but one the health ministers make all the time, of course, with recommendation from many different agencies and their staff. But I think British Columbia generally has struck the right balance on what drugs to cover. But I think there's a lot of pressure there to cover certain drugs when the benefit for the population may be very small, but to these individuals involved, it's huge. And so this is a very difficult decision to make, which is why we should be relying on experts to tell us, and not just health experts, but economists as well, because it's all about the allocation of scarce resources. And that sounds horrible in health, but it's absolutely the truth.
Awesome. Got just a few minutes left. Maybe I'll do a lightning round. Just imagine that the perhaps renewed or new Minister of Health's been appointed. What advice would any of us have for that minister staring down next few years to make some real change?
Well, I think one would be prepared to be in the hot seat. You'll have the highest degree of media scrutiny of anyone in the cabinet, outside of the premier, perhaps. I think the next health minister, or if Adrian Dix continues on, needs to be seen more in the hospital setting with patients, with healthcare workers. Perhaps given the scale of initiatives going on in healthcare, both on the capital and the operating side, and the new programs and some of the types of different services, whether it's diagnostics, surgical backlogs, those sorts of things that are coming good, that are faster, MRI capacity, hip and knee replacements, I think is the best in the country now. And the media doesn't like to cover good news. We all know that, but is to try and get as much attention towards good news, including what we've talked about a lot today is more and more people attached to a GP. So quarterly reporting on the key issues that matter to British Columbians, I think is probably the most important job for the next health minister, is to be proactive in communication. You're always going to have to punch through some of the things that are very unpleasant, where people didn't get the care that they deserved, and play defense. But to try and go on the offense a bit more, I think it would be my advice.
Yeah, I would say the same thing if it was a conservative health minister. I think what we saw is a lot of promises to be made. I mean, we started off with this webinar talking about how this was a huge ballot box question. And I think a lot of promises have been made. And I think the public, should there be a conservative government, are going to be expecting these changes to happen right away. And we can see in Alberta with their refocusing of this whole healthcare system is it takes time. And I think Rob, you mentioned that earlier too, of this can take years depending on what this looks like and implementing, solving all the issues. And the communication is going to be key and being proactive for sure.
Yeah, normally I would say, take your time, get to know the file, but all that's gone. You gotta seem to be getting stuff done. And it's not just announcements. It has to be real, has to be tangible, because this government has made a lot of announcements. And as Rob mentioned, not enough time has come by to realize those projects. Now people need to see it actually matters. So, emergency rooms around the province. Newfoundland has a virtual emergency department. Let's get that started right now. And listen to the bureaucrats. They've already got recommendations waiting for you to look at. Look at them and get it done.
Well, we're at time, but a great discussion. I sure enjoyed this and sure appreciate the participation of all three of you. Hope everyone watching, participating, learned something, enjoyed it. Thanks very much and see you all next time.
Thanks, Steve.
Thank you so much, everyone.
Thank you.
Okay.